My name is Alicia Knoll, and today I will be discussing my study on the influence of muscle fatigue on force and EMG amplitude during isometric contraction. Electromyography, or EMG, can be used to measure the rate of fatigue in working muscles. Previous studies have found that during isometric contraction, EMG amplitude increases while the ability to produce force decreases. The purpose of the study was to investigate the effect of fatigue on EMG amplitude of force, as well as wrist flexors and extensors. It was hypothesized that EMG amplitude will gradually increase due to an increased muscle recruitment and firing, while strength of force will decrease due to an inability to keep up force production as fatigue is reached. This study included 8 volunteers from the Regis University Physical Therapy class of 2021. More specifically, 5 males with a mean age of 26 years and 3 females with a mean age of 22 years. These subjects were able to perform a grip test without pain in their dominant hand, and they did not have any known allergies to alcohol wipes. To perform the study, subjects were required to shave areas of their dominant arm and then use alcohol wipes to further clean these areas so that the electrodes could properly adhere to their skin. Electrodes were then placed over their wrist flexors and extensors of the dominant hand, as well as one proximal muscle for grounding purposes. Electrode placement was confirmed by contracting their muscles and observing an amplitude. A diameter grip was then fit to subject needs. Next, participants maintained a standard position. The standard position includes sitting straight up, dominant arm at 90 degrees, legs uncrossed, and feet flat on the ground. Subjects then completed a maximum hand grip test to obtain maximum voluntary contraction, which was then used to calculate 25% of their maximum force. 25% of maximum force was then maintained for 300 seconds or until fatigue. Overall, the results of this study were not significant. There appears to be amplitude increases in wrist flexor and extensors, which could accurately reflect previous studies. In addition, there may be a decrease in force amplitude towards the end. However, the hypothesis was not supported due to a large amount of calculated error, which can be attributed to a lack of both intra and inter-rater reliability. It should be noted that after 200 seconds, there were varying degrees of amplitude decreases, which could be contributed to participant dropout. As a future physical therapist, it is important to understand how muscle recruitment and force production changes over exercise duration. As clinicians, knowing these changes can help prevent injuries in patients. Lastly, EMG can be used as a tool to specifically measure muscle activation and fatigue. Please refer to references for additional information. Thank you for your time.